Today, I want to talk to you guys about Botox because although we know Botox is a groundbreaking treatment and fantastic, not everyone's getting the results that they want and achieving what they expect from their treatment. And there's very good reason for this. Ultimately, in the UK, training in medical aesthetics is unregulated and extremely poor. Now, when it comes to Botox training, this applies to medics and non-medics. There's a one rule fits all policy for some reason, as in they do exactly the same treatment, using exactly the same dose and injecting in exactly the same places for every single person. That's how they're trained. How is that going to produce good results? Every face is different. Every patient is different. And what I'm seeing more and more in clinic, as more and more people are offering Botox treatments, are poor outcomes and poor results. So, common things to occur. A lot of patients are reporting that after they've had Botox treatment done elsewhere, that their eyelids feel heavy. They're actually having to physically lift their eyelids up to put their makeup on. This is because the Botox hasn't been done correctly for their face. As we get older, it's very common to get some loose skin above the top of the eye, and the eyebrows will naturally start to descend as the rest of the face does. So what someone like that will need is a brow lift. Now, in order to do a brow lift, you can't freeze someone's forehead. If you freeze someone's forehead with Botox, you can't move the muscles can't move, and the brow goes heavy. Now, there might be less wrinkles there, but ultimately you look tired, which defeats the whole object of Botox. So what you need is a brow lift. And again, there's a way of doing brow lift. I've looked at some of these training courses as to how they teach so-called brow lifts, and that's not a brow lift. That's not going to actually achieve what the patient wants. The other thing I want to mention as well is about lines and creases that are ingrained in the skin. So when somebody frowns, obviously a line or a crease appears. That's why they're having Botox. Now, if they're not frowning and there is a line or a crease there, it's called a static line. Botox is not going to get rid of that. It will soften it and it will stop it getting worse, but that crease is ingrained in the skin. So if you're expecting to have a completely smooth frown area or forehead area after treatment, it's not going to happen. We sometimes use fillers in combination with Botox to improve this further. But again, it's about explaining to patients about what they can expect from their treatment. Another thing I see commonly is crow's feet. The training protocols in a lot of courses literally train to do just one area around the crow's feet, which works for some people. But if you've got crow's feet extending down the face, you need to be able to treat the whole area. Many practitioners are not trained how to do this, so you get a partial result. And the latest thing, the latest craze, seems to be that Botox in the lower face. There are uses for Botox in the lower face. However, it's not very often. If you have loose skin, jowls, bit of laxicity in the skin here, Botox is not going to treat that. But the latest craze is everyone's injecting Botox in the lower face, and of course patients are not getting results. The effects of gravity and the way that we age cause the skin and the muscles and the fat to change in the face. So Botox as a muscle relaxant is not going to suddenly lift your face up. There's other ways of doing that. So these are just a few things that I'm seeing commonly in clinic in the right hands. And by the right hands, I mean an experienced practitioner. Don't get me wrong, when I learned how to do Botox over 20 years ago, the training was appalling, and I've made these mistakes. However, through continual training and conferences and listening to experts from around the world, I've honed my techniques and those of the practitioners at Persona. So we now look at a patient and we will advise on the best treatment for that particular patient and give them the likely outcomes and expectations rather than make them a promise that we can't deliver. So I hope this has just perhaps put a little bit of light on some of the situations with Botox and why perhaps things and results are not as good as you'd expect them to. However, in the right hands, they can be fantastic.